Frag, and I'm the respiratory director here at Kindred Hospital, San Francisco Bay Area. I welcome you to Kindred and know how pleased we are to have you join our team here. So today I'm going to talk about a few things that I always talk about before we actually do the Code Purple. Every employee of the hospital division has to do Code Purple because every hospital has ventilators. And in the case of a disaster and our electricity goes out, we may have to ventilate our patients. Now today we have about 30 ventilators in house. That means we'd have to have 30 people that would bag the patient. Now our ventilators do have a 6-hour battery life, but if in fact we were in a major disaster, we would probably be there for a little while. So that's the purpose of Code Purple, is that if we have this disaster, that we can ventilate or breathe for our patients here. Now, I'll go over a few other things. The Code Purple will take place at the end of this little session. So first I'd like to talk about who answers call lights here. Call lights is answered by everybody, including myself. In this facility, we have the light over the bed that is either white, it can be green and red, and it can be yellow and red. Here, of course, the call light is white. That means the patient's asking for something. Secondly, the green and red is our continuous pulse ox. Our patients here who are on airways are on continuous pulse oxes. They monitor oxygen saturation and heart rate. So if that alarm goes off, there's something that's happened to that patient with their oxygen level or their heart rate. The last color over the door is the red and yellow. Those are our ventilators. That means that something's happened to the patient with the ventilator. Now here, as soon as a patient or a vent alarm goes off or a pulse ox goes off, the light stays solid. If you are walking down the hallway and you see especially a red and yellow light flashing, please, we need to get in there. The patient can be disconnected. They can potentially have pulled out their trach, anything. So it's of utmost importance that we go in and check the patient out. And if you're not a clinical person, you just have to wait and call for help. Now, the other thing is, I always emphasize, if you're walking into a patient's room, especially clinical people, the thing you want to look at is the patient and their airway. Is it in? Is it not in? So it's real important here because we have a lot of airways that we get used to checking those patients. Now the other thing is, whenever a new patient comes in that has an airway, the respiratory therapy department assesses that patient for their potential to pull that trach out. So what do we look for? We look for a short, fat neck. We look for somebody who's confused. We look for somebody who may have done it before. And anybody who is in restraints is automatically considered high risk. And the way you will know if a patient is high risk, whether you're a janitor or a cook or whatever, is behind the patient's bed, there's a sign that says high risk for decannulation. That tells you that that person either did it already or has the potential to do it. Now I also talk about restraints. We're a restraint-free facility. However, we have brain injured patients. They're always high risk, by the way. And so when needed, we have to restrain our patient. But for some reason, sometimes a patient has restraints and still pulls out their trach. And that has to do with the restraints aren't on properly. So we all have to be aware of when we go in a room, not just to look at the airway, but is the restraint on properly? Now, the other thing I talk about is how important it is to realize that nobody here is an expert. so that if you go into a room and you have a problem figuring out something, just ask somebody else. This is a place where we all have our backs. You have to be a team player. If you're not a team player yet, you definitely will become a team player at Kindred. It is the place where we support each other because we have very sick patients and we have a lot of family activity. So, another thing I want to reiterate, and this is probably the last little thing, is because of our airways and the number of them, whenever a patient is moved, whether it's repositioned, whether you take them out of the bed, whatever reason, there is always at least two people. There's always the one person who watches that airway and that tubing, and then whatever amount of other people it is to do whatever will help. It's very easy for you to go into a patient's room and the blankets are on the patient, they have this ventilator tubing and it's under their arm, and you go and you just move that patient, maybe they say they're in pain or anything, and the tubing pulls that trach out. So if you have somebody else in there with you, it's always probably the best way to be because the trachs come out. And for those of you who are the nurses and clinician, it's a lot of work. Primarily it's hard on the patient, but it's a lot of work, paperwork, call the doctor, initiate the family when a trach comes out. So, rule of thumb, always have somebody with you to watch tubing and trachs and everybody else to do whatever you need to do with that patient. Now, we're going to go back and do Code Purple. I'm going to go over the steps now with you, and then when we go back there and do the Code Purple, you will have to tell me, I'll say Code Purple is called, and you will go through the steps you're going to do. You will actually be bagging this dummy back here. So, Code Purple is called, you're going to go to the nearest nurse's station. At that time, the charge nurse or the RT will assign you to a patient's room. You're going to go to that room, and before you enter the room, you're going to put on your PPE, your gown, gloves, and mask. You will go into the room. There's an ambu bag at each patient's bedside. You will get the ambu bag, you will connect it to the flow meter of oxygen, and you will flush that flow meter to 15 liters. You will go over to the patient, and for those of you who are nurses, you always say, I'm nurse boo 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 boo. Introduce yourself, be very transparent, and tell the patient that the electricity's gone off. I'm going to bag you. I will stay with you until the electricity goes back on. So you're going to have that bag. You will disconnect the tubing from the trach. You will attach the ambu bag to the trach, and you're going to begin breathing just like CPR, which is 1 breath every 5 seconds. Now, you won't be there by yourself. People will be coming around, and they will be helping if need be. But it's your responsibility to explain to the patient, and you're going to be bagging that patient. We did have a Code Purple years ago, and it went perfectly fine. We didn't have any problems. There was no patient that was in jeopardy, and it's because as a Kindred hospital employee, every year you will do Code Purple. So if you have any questions, feel free to say anything now about call lights or anything. Otherwise, we're going to go to the back of the room. I'm going to count you off in pairs, and we will go back and actually do Code Purple.